June Wiskoski is about to undergo a simple procedure to relieve her carpal tunnel syndrome. What makes this routine surgery so unusual is that the total price, which comes to $2,750, is posted online.
We decided we would have price honesty.
Dr. Keith Smith is the anesthesiologist on duty and the co-founder and managing partner here at the Surgery Center of Oklahoma, which is located in Oklahoma City. Let's say June Wiskoski had been treated instead at a traditional hospital nearby. Not only would the hospital have charged more than double the surgery center's price, since she hasn't met her deductible, Wiskoski would have had to pay the lion's share of the bill herself. At the surgery center, the bill was so low that her employer simply covered it. She paid nothing. Wiskoski ended up at the surgery center because she and her employer were directly responsible for paying the bill. If an insurance company was covering it, she would have had no compelling reason not to pick the more expensive option. The surgery center is part of a growing phenomenon of patients and companies breaking away from the traditional healthcare industry, with its distorted incentives and outrageous prices.
We are done.
As Obamacare drives out what's left of markets in medicine, Americans are increasingly turning to providers like the Surgery Center, which show that it is possible to offer high-quality healthcare at low prices.
The long-term players in the medical business need to be pushed to a new way of looking at things.
Dr. Stan Baker is chairman of the Ear, Nose, and Throat Department at Integris Hospital. Like Dr. Sigmund, he prefers to do his procedures at the Surgery Center of Oklahoma.
The place is run recognizing the needs of busy surgeons to devote their attention to the important technical details and not have to worry about a lot of other things. And that's what happens here.
One of the main reasons our prices are so low is that we don't have administrators in $3,000 or $4,000 suits running around and vice presidents at every imaginable level.
At Integris Health, the top 18 administrative employees made on average $413,000 in 2010. The wastefulness of traditional hospitals is reflected in the way they bill for their services. We obtained an itemized bill for a procedure performed at Integris Hospital called a complex sinus surgery, which treats chronically infected sinuses. The surgeon was Dr. Jason Sigmund, who also does the procedure at the Surgery Center of Oklahoma, where the total price is $5,885. The bill from Integris comes to more than $33,000, although the actual bill was even higher than that, since unlike the Surgery Center's price, that doesn't cover the surgeon or anesthesiologist. Integris can get away with charging more than 6 times the Surgery Center's price, because generally its patients don't pay these bills, so there's no real sticker shock. This leads to outrageous markups.